I'd like to say good afternoon to everyone.
Good afternoon.
It's a privilege to be here with you to talk about what we all have concern with and share with the most dear concern, healthcare. I'd like to start by saying we are not collateral damage. We are not collateral damage. Not Americans, not Arkansans, Arkansans, depending on how southern you are. And definitely not Garland County residents. We are people, not only people, but people who have helped shape this nation, whether through military service, through educational system, through healthcare, through factory or industrial work. You have helped shape this country to be what it is. We have all played an integral part in helping this country recover from one of the worst recorded recessions in history. We are resilient in our efforts and our purpose. We must take that raw talent and focus on first our own Garland County. We, the American people, have the control to change the current mandate. Healthcare is universal. It's a universal mandate. It is a right and not a privilege. We have already paid for this and expect better service than we currently receive. Starting with our local branch of government, we have to make our concerns known. We have to begin to start from a grassroots level and begin to let our voices be heard, to let them know that we're just not going to settle for anything that they choose to give us. Today, we face some of the worst humane acts upon the American people, but it's not ISIS. It's politicians hurting their constituents. It is exempting themselves from the worst healthcare plan in history before passing a bill to strip individuals of their healthcare coverage, somewhere around 24 million. Locally, I like to say things that best describe this community. It's a retirement community. It's a medical community. And it's a low-income community. From a survey of in 2014 from the Community Health Assessment for Garland County, there were 4 things that was listed as primary concerns. One was obesity, mental health, suicide, and teen pregnancy. In Garland County, the obesity rate is 64.8%. In children, it is 35.5%. The thing about obesity and the progression that leads to other various things is that it starts out with weight problem. Then it develops into hypertension. And then diabetes or cardiovascular disease could be the next outcome. Within suicide, in Garland County, the rate is 28.1%. The U.S. rate is 12.4%. Teen pregnancy per 1,000 women in the U.S. is 34.3. In Garland County, it is 55.7. 62% higher than the national average. Behind those 4 things that are listed as disparities in Garland County with obesity, mental health, suicide, and teen pregnancy, the next concern, the 4th concern, is health education and communication. Lack of education regarding healthy behaviors. We have to start there to begin to change the impact in these numbers, because this is 2013 data. This report is regenerated every 3 years. The new report the numbers are even higher. We hope to have educational opportunities to begin to inform the community. We've had a health symposium that took place in April. We're having the second part to that on June the 23rd at the Garland County Library, 12 o'clock noon. That will be a conversation where we will have invited case workers, grassroots people who deal with people every day to see what is the disparity, what is the gaps in services that need to be brought to the forefront, and to make those our main concerns that we address our politicians with. We can all have different issues and we can feel that they're all valid. But when we bring them all together and we can sum up what are the 1, 2, and 3 most important ones to all of us, then as a collective voice, we can go forward and we can begin to make some changes. We don't have to settle for anything. We sure don't have to settle for our current situation right now, to be concerned if you're a senior, you're wondering, if you got health coverage. Right now in Arkansas, in the state of Arkansas, 1 in 4 seniors